When you call 911 for a medical emergency, every second counts. You count on the Spokane Fire Department paramedics to be able to handle any type of emergency. That means realistic, frequent, hands-on training. And Dr. Scott Edminster has more.
There you go, perfect. Now,
what we're doing here is practicing skills, and we're emphasizing skills that are not very likely to happen, but when they are required, they're life-saving. We are doing endotracheal intubations on mannequin heads. All these guys do endotracheal intubations on a regular basis, but it's always good to kind of review that and look at different techniques and you know, teach one another tricks and that sort of stuff. And there's a couple things we introduced today that'll make it a little easier to do routine endotracheal intubations. Some other things we're doing here today that are less common procedures, less likely to be necessary. One of them is doing this quick trach on the pig tracheas over here. Humans are a lot like pigs and vice versa, and so the pig trachea is kind of a nice model for us to use. So we got a bunch of pig tracheas, and the guys are practicing sticking the rescue airway into the trachea. This is something that we use on occasion when we can't get a person intubated and get air into them for any other reason, or maybe they've got an upper airway obstruction or something of that nature. Another thing we're doing over here, Dale is teaching guys how to put in the interosseous needle, which is just basically a hollow drill bit that you drill into the patient's bone, usually in the tibia. But there's an alternative site, which is the proximal humerus, and another alternative site in the lower tibia. And this is a technique that was actually first invented back about World War II, I think, and was used, or World War I, was actually used in World War I, and then for some reason kind of fell out of favor. People went away from it. In the last 10 or 15 years, it's a technique that's been resurrected, and it's really quite effective. You put a needle in the bone and you can push fluid pretty quickly, just like you could through an IV. And when you have someone who you can't get an IV in, then it's the quickest way to get medications and fluids into a patient. Everything paramedics do has to do with speed. They have to be quick, and they can't have to be decisive. And you know, you can't be quick and decisive without drilling stuff. It's like a sport. You know, if you want to be good at it, you got to drill it, drill it, drill it, drill it. And so that's what we do. So we have meetings like this on a regular basis monthly. This month we're actually having 4 meetings so that we can get all 4 shifts in here to practice all these techniques.